In the next few minutes, I'll teach you the major abdominal muscles and exactly what you need to know about their origins, insertions, actions, and innervation, and why they are important for daily function. So a lot of people know about the ab muscles, but in reality, there's a lot of different muscles. There's four main ones that really make up our core. Those are the ones that we'll be going over today. Starting off nice and strong, we have our first muscle here is our external oblique muscle. Okay, so the external oblique muscle is very vast. All of these are going to be very, very large. The origins and insertions are going to have multiple points because you can kind of see how it can get pretty vast back here. So I'm actually going to hide the lat so we can actually kind of see, and I'll hide the serratus anterior here so we can visualize the external oblique a little better. The origin, right? So these guys kind of originate from ribs 5 all the way down to 12. So very vast down here. They start over this way. And then insertion wise, they come around to attach to a lot of different points. They attach, as you can see here, to the iliac crest right here. And then they also go down, come here down to attach to the pubic tubercle, which is kind of on that pubic bone right here. And then also the linea alba. Linea alba is this central tendon kind of line that joins the two halves of the entire abdominal muscles together in the front. So the linea alba is definitely a good part to kind of know. And the xiphoid process up here, which is the bottom part of our sternum bone, which is this guy right here, Latin for sword, which is pretty cool because it looks like a point. The job of the external oblique is to do trunk flexion when they contract bilateral, because we have two of them. And then when one of them contracts, when you mainly do one of them, it actually produces contralateral trunk rotation because of the way it's oriented. It kind of orients itself from superior down this way at an angular motion down to inferior, and so when it contracts, it actually pulls the trunk in the opposite direction. The external oblique is innervated by the intercostal nerves, and we'll go over those a little later. I'll show you what they look like from intercostal nerves, specifically T5 all the way to T12, corresponding to the ribs that it actually starts on. It also is innervated by the subcostal nerve and the iliohypogastric nerve, which, if we remember, is from our lumbar plexus from L1. Additionally, you may be asking, what is this giant white part right in front of us, right? And so the external oblique muscle actually comes over and starts to form what we call the anterior rectus sheath. It's not labeled on here, but it's this big, vast white part that sits over our rectus abdominis muscle and kind of supports that and makes it nice and strong. So this whole white part is our anterior rectus sheath. Moving on to our next one, I'm going to hide this muscle here. Our next one is our internal oblique muscle, or originates very similarly, but it actually originates a little lower. So down at the thoracolumbar fascia, which we can kind of see in this white part here. And then I also hid the lat earlier, so that's kind of where that would be. But it originates back here in the low back region, and then it comes over to attach again to the iliac crest here, and then it also comes down to the pubic crest, so the pubic symphysis down here, again the linea alba, and then as you can see also at the xiphoid process. So similar attachment points. It also does come around to continue contributing to form the anterior rectus sheath, which is this large white part right here. Action, this one flexes the trunk as well, and then also this one produces ipsilateral or same side trunk rotation. So for instance, if the left internal oblique muscle contracted, then you would turn your trunk to the left. It would go towards the way that it's contracting, which is the opposite of the external oblique. Innervation, this one is innervated again by the intercostal nerves, specifically the T8 to T12 intercostal nerves, as well as the iliohypogastric and ilioinguinal nerves, which again we learned in our lumbar plexus, which come from L1. Alright, hiding this muscle here, we'll go on to our one that everyone knows and loves, the abs, or our rectus abdominis. This is a very cool muscle. It has very cool striations in this vertical orientation with white connectors in between the segments, which gives our abs those ab formations. That's kind of what that kind of looks like. I'm going to isolate this one so we can appreciate the attachment points here. And this guy right here originates all the way down here at the superior part of your pubic bone right here. And then if we zoom out, we can actually see how it actually comes up and attaches to the xiphoid process, as well as the costal cartilage of ribs 5 and 5 through 7 about, which is pretty cool. So yeah, it's a very vast muscle, very tall and long as that comes up to attach to our ribs. And the job, of course, is trunk flexion, right? So it actually flexes our trunk and stabilizes the abdominal wall so that all of our organs are nice and stable inside of our abdominal cavity. This is also innervated segmentally by the intercostal nerve, specifically around T7 to T12, and then also innervated by the subcostal nerve. And we can hide this one. Our next muscle here is the transverse abdominis, and the transverse abdominis muscle is super cool. Again, attaching in the low back region at the thoracolumbar fascia down here, and then coming around also attaches to that iliac crest, and then it spins around here if we spin it, and then it comes around to attach to the down here to the inguinal ligament that would sit right here. And then as well as coming around, this is where it starts wrapping around the front, is the linea alba, and then comes around for the pubic crest as well down here. So yes, very vast muscle. This is the deepest of our layers, right? So we had our superficial to deep, we're working that way. This is our deepest abdominal muscle from that point. What is the job of the transverse abdominis? This guy is a deep spinal stabilizer, okay? It actually attaches all the way at the low back region, so it's responsible for stabilizing the lower lumbar spine, as well as keeping the abdominal organs nice and tucked in and supported in our abdominal cavity as well. It operates as like our natural squat belt. It's pretty awesome. And especially in PT, we actually focus a lot on trying to activate this muscle and trying to get a little stronger for people as they're moving, right? If you can activate this while you're moving, you're going to create a little more stability in your lumbar spine so that you could hopefully reduce low back pain. So a very good muscle to target if you're trying to reduce the low back pain. Innervation, the transverse abdominis is innervated again by intercostal nerves, specifically T5 all the way down to T12, so it's a very long and large muscle here. Also innervated by the iliohypogastric and ilioinguinal nerves from our lumbar plexus as well. I wanted to talk to you guys about the neurovasculature as well, and there's a little trick that I like to remember, and it's called VAN, okay? And I'll explain what that means. I'll have to hide our external oblique. This is a different view. I'm just going to hide this, and now we can actually reveal what I'm talking about here. So this trio right here, there's this trio that happens in between every single one of our ribs, and it's called VAN. What that means is the vein, artery, and nerve. So VAN meaning like the most superior, A in the middle, and then N for below that is our order of the neurovasculature in between each of our ribs. And these are the intercostals, okay? We talked a lot about the intercostal nerves. So it's intercostal vein, intercostal artery, and then the intercostal nerve. And they're all named based on basically where they're at and sitting in between the ribs. I can hide the internal oblique and you can kind of see it a little better, right? So you can see how these kind of wrap around. So for instance, our 10th intercostal nerve will wrap around the trunk, and it came from right below our 10th rib, right? And that'll actually go back towards the vertebrae of T10. I can actually show you guys this. It'll wrap around and then originate in between the ribs, and that's why it's called intercostal, between the ribs, that nerve root of T10. So that kind of stems from that. So that's kind of how all of these muscles are innervated and everything as far as our abdominal muscles. And those are all the muscles that make up our abdominal wall that help us support our entire bodily structure, keep us upright, and keep us nice and stable while we're moving about our daily lives. I hope you guys learned something. I hope this was helpful and that you have a better understanding of the different layers of the abdominal wall and all the muscles there and what they do. If you watched to the end of the video, thank you so much. I appreciate it. Please consider subscribing. It really helps me continue to make high quality anatomy videos for you guys. I am the PT guy, educating you on God's wonderful creations. I'll see you in the next one.